Welcome back. This is our bonus episode, and this is our podcast, Little Squirts, Big Questions, where we're still going over the potty puzzle. I'm John Payne, physical therapist.
I'm Kellie Witten, physical therapist.
And we have with us Bree Allred. She is an adult pelvic floor therapist. So she also has a background in pediatrics, so we're really excited to have her here to see her perspective on children and then also with adults and how maybe some of those things that we've been talking about extend into adulthood or things that maybe could be addressed earlier than adulthood. So we spent a lot of time talking about constipation, bedwetting, bladder control, done some anatomy. So I feel like our listeners are pretty well versed on those sorts of things, hopefully at least know what we're talking about. So but we've even touched on nutrition. And
we've also talked about like the sensory side of toileting, especially like for toilet training and when things aren't going well.
Just going over all those things that go into, at least in the pediatric world, where we're talking about a lot of pee and poo, right?
Yep.
So I wanted you to talk about, Bree, is like, what are you seeing in adults with pelvic floor?
All right. With adults, it's probably a lot of similar stuff. I mean, when you're leaking urine and you don't want to, a lot of times it's mamas that are wanting to exercise or cough or sneeze or jump on the tramp with their kiddos without any urine leakage. We deal with constipation. We deal with pelvic pain, either from a menstrual side of things, where it's like your periods are way painful putting you in bed and they shouldn't be, right? It should be manageable pain. If we're having painful intercourse, that's never okay.
Yeah.
Even on your first attempt, it shouldn't be painful. And so we're dealing a lot with that. I start seeing people with like anal fissures and hemorrhoids and things that way from a constipation standpoint, or from a fecal leakage where we're really struggling to hold back our bowels as well.
Yeah. I think a lot of time when you see an adult pelvic floor, we typically associate that with like, okay, once you've had a child, like that's when things fall apart. But are you noticing things that maybe have been present prior to being pregnant and having a child?
So often we ask people, how long have you struggled with these issues? Did you have any troubles before childbirth or things that way? We see it present so often that it's like, oh yeah, when I was an athlete and I would jump on the tramp or I would run, I had urine leakage, or I've struggled with constipation since I was a baby. I mean, there's a lot of, I won't say it's everybody, but oftentimes we do see a childhood component to these issues that just never resolve.
Yeah. So why is that? I feel like we've talked about this, like early intervention, like things kind of come up, and I think we made the comment, when you go to your 16-year-old visit to get vaccinations for school, they don't ask you, are you still wetting the bed?
Yeah.
Everyone assumes that these things are taken care of. So,
and if you do bring it up, a lot of times they're like, oh, they'll grow out of it.
Yeah.
Right.
And it doesn't necessarily happen.
Yeah. Why not?
Yeah.
Why wouldn't those things just disappear on their own?
There's dysfunction.
Yeah.
Right?
Yeah.
Just because it's like, oh, this is kind of a common thing and we see things get better every year. And it's like, yes, we do, but in small percentages. And if you're that child that's bedwetting still at 12, 13, 16, 18, it's an issue.
Yeah.
Right?
Yeah.
So I think there's some of it that it's like, oh, we'll just grow out of it. Oh, it's kind of a common thing that we see and it gets better every year as you get older. But the reality is we have some underlying dysfunction. And we could even go back to, some people would say there's some birth trauma associated with it. We could go back to, is there some childhood trauma? Was there a fall? Was there abuse? Hopefully not, but sometimes that can be a case as well. But there's underlying dysfunction, and really getting down to what is the cause. Are the muscles too tight? Are the muscles too weak? Is there things that were maybe not addressed as a kid that are now well ingrained pathways from your brain to your body?
I think you make a good point where we're strengthen patterns, right? We reinforce them throughout our day. We maybe, if we're conscious, we'll try and undo them, but we strengthen them. So the longer we spend strengthening them, the tighter that bond is.
Yep.
So, I mean, how long do you spend like working with people on these sorts of dysfunctions? Like, what's an average?
I would say average is like 8 to 12 visits for an adult. And then there's some where it's more, I would say the longer it's been present, the longer it takes to undo. Right? Just for that habitual nature. That like, okay, I always give the example of a brain body connection being a hiking trail. And you can tell which ones are well traveled and you can tell which ones are grown over, right? When
Mhm.
we have a well-traveled path that is actually not a good path,
Yeah.
it takes some hard work to kind of unlearn the bad things and then learn.
Mhm.
Do you know what I mean? Maybe this
Mhm.
grown over path that it's like, this is the better way to do it,
Yeah.
but we've been doing it the old way so much. So
Yeah.
the longer things are there, the longer they take to undo. But we'll
Mhm.
usually do 8 to 12. I would say the most is maybe 20 visits, and that we're working with people for 6 months to a year.
So I want to divide these up just a little bit. Constipation, and then
Yeah.
we'll go over like urine leakage or
Mhm.
bedwetting. So I'd like to hear from your perspective, Kelly, the things that you're seeing in childhood and see if they jive with things that Bree is seeing in adulthood. Like, do those things mesh?
Yeah.
Or are they so different in pediatric versus adult?
Yeah. I mean, I would say even when we're seeing kids who maybe they're just presenting with bladder dysfunction, there's almost always some bowel dysfunction underlying. So there's almost always typically constipation. That is a huge thing. And I feel like that is a really challenging thing. And a lot of times it is, oh, well, they were constipated as a baby, but they're not now. It's like, well, let's delve into that a little bit more. If they were constipated then, why do you not think they're constipated now? And most of the time you really look at it, yes, they're still constipated.
I always say, especially in kids, assume
Yeah.
constipation. It's like you're
Uh-huh.
constipated unless proven otherwise.
Exactly. Yeah, exactly. And I mean, it's so funny because I feel like I've gotten to the point where you can just look at a kid and how they're standing and everything, and it's like, oh yeah, they're constipated. You can say no, they're not, but so I feel like that is a big thing. It does sound like that. You're seeing that a lot carrying over into adulthood. If we don't have that good mobility of the pelvic floor and we don't have the good core strength and diaphragm mobility movement to allow that, that's not something that anybody's just going to figure out on their own, really.
Yeah. And I would say constipation isn't quite as big of as a factor as an adult.
Yeah.
It's still something we're screening for, and we're asking about movement,
Mhm.
bowel movements. We're asking about how easily things are passed. When you look in the toilet, what does your stool look like,
Yeah.
right? All of those.
Yeah.
So we're still screening that area, but I wouldn't say that it's like if I have a kiddo with urinary issues,
Mhm.
it really is like we're looking at bowel control and things that
Mhm.
way first.
Mhm.
As an adult, I'm screening it, looking at contributors from that, but it isn't always that like that's one of the first places you go
Yeah.
as an adult either.
Yeah.
Where do you typically go first with an adult?
Honestly, I look at the area where they're having problems. So if they're having urinary issues, I'm
Right
screening
there to the
bowel and
bladder.
I'm looking at
Mhm.
what's going on in the bladder,
Mhm.
front portions of the pelvic floor,
Mhm.
abdominals function, inner thighs, because those are going to be integrating with things as well. When we're dealing with bowel issues, or leakage, constipation, things there, I'm really looking at the back portion of the pelvic floor and
Yeah.
glutes and
Mhm.
postures, because glute squeezing can put you in a certain place and
Right.
it leads to
Yeah.
tightness in that back area.
And you'll do an
Mhm.
internal exam
Yes.
typically, whereas we're not
Mhm.
internally examining children for obvious reasons, right?
Yeah.
So,
Mhm.
but we'll do some biofeedback and
Mhm.
try and look at it globally and see if we
Mhm.
can tackle those things. So what kind of muscle groups are you seeing with adults that are having some issues with constipation? Like what you say that muscle dysfunction, dive into that a little bit.
Yeah. With constipation, there's usually two culprits. And I can't say everything, but usually they're either tight in their pelvic floor or it just can't coordinate well. Meaning when you need those muscles to relax and open the anus or open the door, I
Yeah.
tell people,
Mhm.
if it's tightening and closing the door, you're gonna have to generate a lot more force to get through a closed door than you are to get through an open door.
Right.
Right.
Mhm.
So that's a
Yeah.
coordination issue. And it may not be that it's like generally any other time you're totally fine. You're not tight. But when you try to poop and you bear down
Right.
and you close the doors with that,
Yeah.
then we've got a
Yeah.
coordination issue.
I know you wanted to say sphincter.
I like the
People
door.
don't use sphincters unless they have doors.
I know, as John was like, how many parents laugh when you say sphincter? And I'm like, I really don't say that word hardly ever to
She's like,
families.
"None."
Kids
You're
are
the
like,
only
what's that
immature
word?
person. Okay, well, fine. Well, dads don't come with their kids, but if they did, you said
I would laugh
sphincter,
at it.
they'd be like, okay, well, let's talk about like the bladder portion. Like, what are you
Yeah.
seeing like with kids when they're having bladder leak?
Pretty typically, I'll see either like delayed toilet training, so like a delayed independence at achieving, or we're having ongoing leakage. Occasionally, I'll see like some bladder pain or pain with urination. Frequent UTIs is another one, and then prolonged bedwetting. a lot of times those are kids I'll get who are a little bit older and they don't have any symptoms except at nighttime. A lot of the other kids I have, they have daytime and nighttime symptoms. And a lot of them aren't even that concerned about nighttime because the daytime has been such a challenge that they haven't even considered that nighttime is something that needs to be addressed as well.
Just as you're developmentally appropriate, it's like daytime comes first.
Yeah,
So if you don't have
exactly.
that,
That's why I always tell them, like, we're not even going to touch that anyways till we're doing well in the daytime.
Yeah, pretty soon with adults.
with adults from a urinary side, we get a whole gamut, right? Like people, they can't pee when they need to, like they get an urge to go, they sit down on the toilet and they can't go, they can't start a stream. To people that are going all the time because they get an urge and they can't delay, or people that are coughing, sneezing, exercising, and having leakage. And so it can really vary based on those symptoms, but those are the common ones that we're working with.
Yeah. Can you speak to UTIs? Do you see the effects of UTIs?
Oh, for sure.
What are those?
For sure. You just get in bad patterns, a lot of it. And there's a lot of factors that go into that. If we're holding urine or can't empty well, things that are stagnant. I mean, you think of a pond or a river, or like when it's not flowing, it grows gunk, right? So the same things happen in the bladder. If we don't have a good, what we call biome or good environment in the vagina or in the opening of the penis, it's a little less common, I think, in males just because of the nature of our anatomy. If we don't have a good environment there where we've got good bacteria that are fighting the bad bacteria, if they can't win that fight, then we're getting more chronic UTIs as well. In my age, hormones play a big role in that as well, in creating that good biome. So as we get older and into menopause ages for women, for males, as they get older a little bit too, things just aren't as good at self-cleaning, right? And so we have a little bit higher instance of bacteria. You start thinking, okay, if I have a UTI, we often get burning with urination, which causes pain, which often makes it to where your body's like, I really don't want to go. Right? Yeah. So it's kind of responding by holding back and tightening those muscles. And then we get to where we get a little bit more bladder holding sometimes because of that.
And start developing a new pattern.
Yes, you start developing a new pattern and a holding pattern, and you don't want to go as often, which also feeds the problem, right? Because now we've got more stagnant urination. We're not emptying as well. And then we get patterns to where your bladder's like, there's something in here that I don't like. I want to get it out, right? Because it's like for an infection, it's like, I don't want it to stay in my body. I want to get it out. So it's going to make you go to the bathroom more frequently. Well, now we get stuck in a holding pattern, frequent urination. And if that's the norm, that's the pathway. Right? I have to pee. It decreases bladder size a little bit or contractility of the bladder muscle. And sometimes we're going way too often because it creates that need.
Yeah. Okay. So what would you say to a parent of a child who's struggling with some of these issues?
The earlier you can deal with it, the better, because you have less patterning that develops. But also, I love our physicians, and they're going oftentimes with the best education that they had or the best research at the time. But I'm like, if kiddos are still having issues by age 6, that is honestly even well past the time we should start. And oftentimes they're waiting till 8, 10, 12, just saying, well, we'll see what's happening next year because they should grow out of it.
One more year to grow out of it.
Yeah.
Be a little bit more of an advocate to be like, no, this is an issue and I want to get it taken care of. I don't want to wait and see if they grow out of it, because every year is another year of patterning that you're going to have to break and unlearn.
So what would you say to adults that are listening to this?
Once again, the earlier you do it, the better, right? One of my favorite sayings is, what's common is not normal, especially for women after childbirth. We've been told, it's like, oh, you've had a baby, so you're going to leak, right?
Yeah.
And it's like, actually, no. Just very similar after you have a surgery, especially for athletes, the first place they're going within a couple of days is to rehab. Why don't we do that? These are still muscles. They're not getting back to their full function after an injury, after a surgery, after things that are happening there.
For sure.
The sooner the better. And it's never too late. And I think the same for kiddos, right? I'm like, I still see adults that have had issues lifelong, and we can still fix them. So it's never too late. And the sooner you can do it, the better.
Yeah. I think you'll always be glad you did, right?
Yeah.
Yeah.
You know, you're like, man, this little thing, it just creates, it's like a sliver. You know, it's there, it annoys you, maybe not enough that you want to like cut your finger off, but it's just there until you finally just get it out. And you're like, man, that doesn't annoy me anymore. It's kind of nice.
Yeah.
So any final words that you would say, Kellie, to
I don't think
parents
so.
that are...
I mean, I think exactly what Bree said, like the sooner the better. And that like really being an advocate for your child, because I find a lot of the patients that end up here with me are like, we've gone through all these avenues, are very frustrated and feel at a loss of like, how do I help my kiddo? I know this isn't normal, but there's nobody here giving me a good tool. Like I'm given, put your kiddo on Miralax and that's the end of the road. Well, what next? I don't want them to be on Miralax the rest of their life type of thing. Or, what if we're traveling and we miss a dose of Miralax and then all this stuff happens, but yeah, there's things out there that can help. And yeah, like Bree said, it's never too late.
Yeah. And you can, in the state of Utah and through much of the United States, depending on who's listening and watching, right? But you can self-refer to physical therapy. So you don't have to have a physician referral. You can come see us directly. You don't have to wait for somebody to tell you to come. And spread the word. If you've found benefit there, it's like, hey, actually, there's physical therapy for this kind of stuff.
Yeah.
And even though diapers are made for every size, from small to large, doesn't mean you have to wear them.
Yep.
That's true.
So that's perfect. So I sure appreciate you coming to see us. And so if anyone listening wants to see Bree, she can be found at Luna Physiotherapy in North Logan, Utah. Yeah, she's great. A lot of good things we hear from her office. And so thank you for coming by. And Kellie, thanks for sharing all your expertise on the pediatric piece. And so that's it for now. We'll see you later.
Thanks, guys.